Joe Rogan takes BPC-157 and loves it.
BPC-157.
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 But should you take it? Well, today we're delving into the nuance and the actual science and effects of this peptide, which people say can heal you up like Wolverine. And spoiler alert, not everyone should be taking this one. But if you do decide to take it, what form, dose, and for how long should you be taking it? We're answering all that, but first let's jump in with how this peptide actually works. BPC-157 stands for Body Protection Compound 157, and it also has a bunch of other names you might see when researching it. And to be clear from the start, BPC-157 is not approved for human use. So any injectable form you might be buying is technically for research use only, which is the case for a lot of peptide therapies, and BPC-157 is a peptide, and essentially peptide just means a short chain of amino acids. Specifically, BPC-157 is a pentadecapeptide, or 15 amino acids linked together, and very importantly, it's derived from human gastric juice, which makes it very acid resistant, unlike many other peptides, and that's going to be super important when we talk about routes of administration later. BPC-157 acts upon a few main pathways to give it some pretty promising effects when it comes to musculoskeletal injury and repair, wound healing, gut health, and maybe even neurologic health. Specifically, its main mechanism of action is increasing blood flow to the site of injuries. And increasing blood flow is obviously super important for healing in general because it gives oxygen and vital nutrients to the tissue in order for that tissue to repair itself. And BPC-157 increases blood flow through two main mechanisms. One is through increasing nitric oxide synthesis. And nitric oxide is a very potent vasodilator, or something that opens up the blood vessels, and it's very potent at inhibiting platelet aggregation, essentially inhibiting that blood from clotting up. And both of these things then allow for more open blood vessels to allow blood to flow to the site of injury. And the second main mechanism is its ability to increase VEGF expression. And VEGF stands for vascular endothelial growth factor, and VEGF is a crucial signaling protein for the process of angiogenesis. And angiogenesis is essentially just the creation of new blood vessels from already formed blood vessels. And this obviously allows for more blood flow to areas of injury. And beyond just improving blood flow, BPC-157 also directly helps repair the tissue. This is partly due to increased collagen synthesis, and also due to the fact that BPC-157 increases growth hormone receptors on fibroblasts. And fibroblasts are essentially the cells that are responsible for building connective tissue like tendons and ligaments. So through this increased blood flow and through this direct tissue repair benefit, BPC-157 derives its main effect, which is healing from injury. And specifically, BPC-157 really shines when it comes to healing tendon and ligament injuries. And this is because tendon and ligament injuries are notoriously tricky to treat because they have low blood flow going to them. So you can imagine that BPC-157's ability to increase angiogenesis and increase nitric oxide really help out here. One study specifically cut rat Achilles tendons completely, then administered BPC-157, and these Achilles tendons were able to heal. Another study similarly cut rat MCLs, and again gave BPC-157, this time in topical, oral, and injectable forms, all of which allowed for the healing of the rat's MCLs. And even when the Achilles tendon is completely detached from the bone, and then BPC-157 is given, the tendon is able to reattach back to the bone and heal. So across a wide range of tendon and ligament injuries in model organisms, BPC-157 has been shown to have a ton of promising effects. Similarly, BPC-157 has also shown a ton of promise in model organisms at being able to heal muscular injuries. Specifically, one study looked at cutting the quadriceps of rats and then giving BPC-157 injections, and again, the quad was able to heal in these rats. Or another mechanism of injury, such as a crush injury, was also studied to the calf muscle in rats. And yet again, BPC-157 injections and topical administration were both able to heal that calf muscle. And finally, although less commonly studied, BPC-157 also shows promise in healing bone injury, such as a fracture. And specifically, there was one study that looked at bone defects in rabbits and then giving BPC-157, and these bone defects were able to heal. So across muscle, tendon, ligament, and bone injuries in model organisms, BPC-157 has some very, very promising results. And its effects effects don't stop there. BPC-157 has also been extensively studied in animal models for its effect in gut health, which makes sense given it's a peptide that's derived from human gastric juice. And its positive effects on gut repair really have a lot to do with, again, that improved blood flow, but also are due to direct anti-inflammatory effects, as well as direct gastrointestinal healing effects. And due to these mechanisms, it shows a lot of promise in healing a wide range of gastrointestinal issues. For instance, it has been studied in rats for inflammatory bowel disease, or ulcerative colitis, or Crohn's disease, where it allows for decreased intestinal ulcers from these diseases and also caused a decrease in complications of these diseases. It has also been shown in rat models to improve healing of intestinal anastomoses, which provides a lot of promise for its potential use after colorectal surgery, in which part of the colon is taken out and then has to be stitched back together. BPC-157, according to this rat study, could potentially help here. And it's also been shown to improve gut healing when there is an injury due to ischemia, or essentially a lack of blood flow. So this one's obvious due to BPC-157's main mechanism. And again, this study was also in rats. And maybe even more obviously, BPC-157 in rat studies has been demonstrated to help heal stomach ulcers, obviously because it is derived from gastric juice. And specifically, it's also been demonstrated in rat studies to have protective effects from gastrointestinal injuries from NSAID use, or the class of drug that is ibuprofen. And this is due not only to, again, all these mechanisms we already talked about, but also due to some direct cytoprotective properties, or essentially the ability to protect a cell from damaging molecules. So basically, the main takeaway from all of this is that in all of these rat studies, BPC-157 has been very promising for its effect on a wide range of gastrointestinal issues. So it stands to reason that BPC-157 might even have some promise when it comes to less severe gastrointestinal issues, such as IBS or those with leaky gut. And it doesn't even stop there, because we also have some pretty significant rodent data when it comes to brain health and nervous system health as a whole. Due mainly to the mechanisms we've already discussed, for instance, one study looked at the ability of BPC-157 to limit injury and lasting damage from stroke. Essentially, they cut off blood supply to the brain of these rats and also then gave BPC-157. And this allowed the rats to make a full neurologic recovery, which is just amazing. Similarly, in a model of traumatic brain injury, or TBI, BPC-157 was given to rats after a weight was essentially dropped on their skull. This allowed the rats to make a better neurologic recovery, have better outcomes, and better survival. It has also been shown in rat studies to significantly improve nerve healing, such as healing the sciatic nerve after being cut in rats, and it's also been shown to improve spinal cord injury healing in rats. And aside from just healing from physical injury, BPC-157 has also been demonstrated to have promise in healing mental health conditions. For instance, it has been shown to decrease schizophrenic symptoms, likely due to its impact on the nitric oxide pathway, but also due to its amazing impact on the dopaminergic pathway, or the dopamine pathways, probably due to its ability to stabilize dopamine release and sensitize dopamine receptors, which similarly, due to its ability to positively regulate neurotransmitters, such as not only dopamine, but also serotonin, BPC-157 has also been shown to decrease symptoms of chronic depression and chronic stress in rats. And this might be also due to the fact that BPC-157 has a very positive effect on the gut-brain axis due to how well it calms inflammation in the gut. And then essentially a less inflamed gut equals a less inflamed brain equals less chronic stress and depression. So all in all, although most people are not taking BPC-157 for neurologic issues, it does show some promise based on all these rat studies to have a positive effect on neurologic health. And the last main group of benefits to talk about briefly is BPC-157's potential benefit on cardiovascular health. And while this area has been researched less, it's postulated that BPC-157 might have this benefit due to its improved nitric oxide production, its anti-inflammatory properties, and its cell level protection. Specifically, it's postulated that BPC-157 could decrease tissue damage from heart attacks or could even improve heart contractility in heart failure patients. However, most of this is just postulated again from rat studies. So all these effects are amazing and everyone should be taking it, right? Well, again, wrong, because BPC-157 carries some significant potential risks that in my mind really limit when it should actually be used. So let's delve into the safety and risks of BPC-157 to decide who should actually consider taking it. And to start the safety and risk discussion for BPC-157, let's start with the good news we have on the safety front. Peptides in general, including BPC-157, have a few things going for them when it comes to safety. One, they're rapidly metabolized and excreted by the liver and kidneys, making them not accumulate in tissue like a lot of drugs would. Two, they often have very specific sites of action, meaning they're less likely to have off-target negative consequences. And 3, their metabolites are just amino acids, meaning they're non-toxic. And again, that's not the case for a lot of drugs. And then for BPC-157 specifically, in animal studies, there are no known toxic doses. Even when doses of 10 to 20 milligrams per kilogram are given, or doses are given for multiple weeks at a time, there have never been any reported toxicities. However, that is in animals. In humans, we have no such safety data. You might have mentioned that every single study I've mentioned so far has been in animal models. And this is where we start the discussion of the drawbacks / the risks of BPC-157. And really, the first main risk that we have to talk about is the fact that there, again, are very limited human studies of BPC-157. To my knowledge, there are only 3 detailed, peer-reviewed human studies on BPC-157. And even in these studies, the safety data is significantly lacking. One of the studies was on 12 women with interstitial cystitis. They only received 1 dose of 10 milligrams of BPC-157 into the bladder wall. It did resolve their interstitial cystitis symptoms or symptoms of an inflamed bladder. However, there was no prolonged follow-up to actually determine if that injection was safe, and it was only 1 injection. Another human study was looking at just the safety of IV or intravenous use of BPC-157. They only had 2 participants in the study, and they gave them a 10 milligram dose one day. The next day, they gave them a 20 milligram dose, and then they tested their labs the day after, and they didn't find any negative harmful effects. But again, only 2 doses, no prolonged follow-up. And the last study was a retrospective study, which basically means they looked at past uses of BPC-157, and they essentially called 16 people who had had BPC-157 injections into the joint space of their knee. They asked them if they had resolution of their knee pain symptoms, and they had, but no safety data was collected. So while these very short-term studies didn't show harm, 1, they are not actually demonstrating how people are using BPC-157 today, which is over the course of weeks, not just 1 or 2 injections. And 2, they only used a few people per study, didn't do a prolonged follow-up, and didn't even really collect great safety data as it is. So we really do not have any good human safety data when it comes to BPC-157. And the one study that was actually supposed to test for the safety of continuous use never actually published their results. It was a study that was set up for 42 healthy individuals to receive oral BPC-157 in single doses of 1 to 6 milligrams, and then repeated 3 milligrams 3 times per day dosing for 2 weeks. However, again, the researchers canceled their submission of the results. And why this is really speculative. It could be just due to lack of funding or poor data collection, or maybe negative results. But the lack of transparency on where the results went does raise some legitimate concerns to me about what the trial actually uncovered. And that is all we have when it comes to detailed human peer-reviewed data on BPC-157. So while there might be some anecdotal evidence saying that it's safe, or a non-detailed abstract on BPC-157 enemas in humans saying it's safe, or even non-peer-reviewed, non-controlled studies that say it's safe, we cannot actually rely on this data for human safety, as we have no idea what safety parameters they were checking, and we have no idea of their actual detailed protocol. So for that reason, it is important to speculate on the theoretical risks of taking BPC-157 long-term before just taking it willy-nilly. And the main theoretical risk of BPC-157 comes from its greatest strength, meaning that its greatest strength is probably also its greatest weakness, and that is its ability to promote angiogenesis. While angiogenesis is great for wound healing, like we just talked about, this ability to create new blood vessels is also great for cancer to rapidly grow and spread. Essentially, once a tumor grows past a certain size, it's not going to be able to get enough blood flow to all parts of the tumor, meaning it won't be able to get enough nutrients to the whole tumor, which are needed for that tumor to rapidly grow and continue to expand. So one of the ways that cancer bypasses this problem is it increases the expression of VEGF, which again, BPC-157 also does, and it's one of its main mechanisms. And this ability of cancer to hijack that VEGF pathway is why there have been drugs developed to actually inhibit VEGF. And these are cancer-treating drugs. So theoretically, it is a large concern that BPC-157 could aid in this process of angiogenesis for cancerous tumors. Because if you have an active cancer or a disposition to develop cancer and you take BPC-157, you may just be allowing that cancer to grow and divide. And while there are no studies demonstrating this effect, either in humans or rats, there have also been no long-term studies with prolonged follow-up. So we cannot rule out this negative effect of BPC-157. And even aside from its angiogenic properties upregulating cancer, BPC-157 also acts upon other biological pathways that are upregulated in cancer. For instance, we talked about BPC-157 increasing growth hormone receptors or directly stimulating tissue repair. These molecular pathways are often hijacked by cancer for more rapid growth. And then while this one is more theoretical and less likely a major concern, BPC-157's ability to downregulate pro-inflammatory cascades can also decrease immune surveillance, which is important for your body's ability to detect and eliminate cancer cells. So all that to say, while short-term side effects are also definitely possible and just unknown due to the lack of human data, the real long-term theoretical risk of taking BPC-157 is potentially increasing your cancer risk. So because of that, my recommendation on BPC-157 is this. If you are someone who has active cancer or someone who even has a precancerous diagnosis, such as a precancerous colon polyp, or you're someone who even has a strong family history of cancer, I would definitely avoid BPC-157 in this case. And due to these theoretical cancer-promoting effects, even if you don't have active cancer, precancer, or a strong family history, before you take BPC-157, I would make sure that you are properly screened for cancer. This means being up to date on your colonoscopy, your PSA and DRE or your prostate cancer screening, your mammograms, your pelvic exams and pap smears, your chest CTs if you are a prior smoker, and your skin checks for skin cancer if you're at high risk for that. And even then, I would not just be taking this one for prevention or just taking it indefinitely. There is obviously no way to continuously check for cancer, and even these screening methods are not 100% sensitive for every single cancer. So the risks to me really outweigh the benefits for this long-term continuous use. So for me, the true use case of BPC-157, until it's proven safe in human trials, is to use it after an injury, either for gut health or musculoskeletal injury that just will not heal. You've tried other methods and they're just not working and you're at your wit's end with pain or with functionality concerns. Then a short course of BPC-157 would make sense and the benefits might outweigh the risks as long as you're properly screened for cancer. Because after all, this is not even proven to be a magic bullet anyway. While we do have some pretty impressive rat data and some great anecdotal evidence, we have no strong human evidence that this is actually proven to work. And furthermore, this whole discussion thus far has been irrespective of the fact that BPC-157 is not currently FDA approved for human use, meaning that you can't get the injectable form from a compounding pharmacy, which is highly regulated and you can vet to make sure that you're getting a high quality, safe product. Instead, you'd have to get the injectable form from an online research use only supplier, in which it's impossible to truly vet them because there are no regulatory practices for them. And peptide creation is a very intricate process that I believe needs to be strictly regulated. So for this reason, I'm not really currently recommending anybody take BPC-157 in the injectable form until you can get it at a compounding pharmacy again. That being said, I did want to include the practicalities of its use in this video, meaning the forms, the dose, the timing, the duration, both for oral use and in case the injectable form becomes FDA approved again. And in case you're still not going to heed my advice and you're gonna still get it from an online supplier, I at least want you to have better odds at not hurting yourself. So at the end of this video, I am gonna include theoretically what makes a good online supplier. However, that being said, even good online suppliers come nowhere close to the quality and safety and regulation of a compounding pharmacy. So still, I'd stay away. But to jump into the practicalities of BPC-157, first we have to talk about the forms, which can be tricky for BPC-157 because there are many forms. There's the oral form, there's topical, there's intravenous use, there's subcutaneous use, all of which have been used in animal studies. And this again is where it becomes important that BPC-157 is derived from human gastric juice. Again, meaning that it's more acid resistant than most peptides and can withstand the harsh environment of the stomach and then eventually be absorbed properly. But do we actually have any evidence as to which form is superior? Well, in the animal studies, the ones that do actually compare oral versus topical versus IV versus subcutaneous actually don't really have any demonstrable evidence that one form is better than the other. However, there are not that many studies comparing all these different forms, and most of the rat studies are just injections in one form or the other, especially for non-gut health related issues. Furthermore, we also don't have much data on the pharmacokinetics of BPC-157, or essentially how bioavailable all the forms are. The IV form, though, for instance, would be 100% bioavailable, but that's not really obtainable for humans for everyday continuous use. And for the other forms, we really only have one study looking at the bioavailability of BPC-157. Specifically, this study looked at intramuscular administration in beagles and rats, and the beagles, which are a better human model than rats, demonstrated a 45 to 51% bioavailability for intramuscular use. And we can estimate based off this that the subcutaneous use in humans, which is popular, is only slightly less than this. So I would say that a good ballpark estimate would be that subcutaneous injections of BPC-157 are about 35 to 50% bioavailable. And even though BPC-157 is one of the most bioavailable oral peptides, general pharmacokinetic properties tell us that the oral form will still be much less bioavailable than the sub-Q form. An educated guess would be about 20 to 35% bioavailability for an oral BPC-157. And then again, based on general pharmacokinetic principles, the topical form will be even less systemically absorbed than the oral form, closer to 10% max bioavailability. So all to say, your best practical form for getting high systemic levels of BPC-157 is that subcutaneous injectable form, followed then by the oral form. Topical forms, again, will have much lower bioavailability and much more varied bioavailability, so I'd stay away from these unless you're using it for a very superficial wound, especially given the fact that it's even more pricey than the other forms. And getting these higher systemic levels with the subcutaneous injections or the oral version are going to be important for gut health, but especially for those deep tendon, ligament, and muscle injuries if you actually want to have an impact on those. So for that reason, the subcutaneous injectable form is generally better than the oral form for impacting musculoskeletal injuries. And this is generally the case anecdotally as well. And a quick aside here is that if you are using the subcutaneous injections, you don't actually have to inject it locally right near the site of injury. This is because when you inject it subcutaneously, it's very rapidly taken up and metabolized. So almost all of it is going to be quickly taken up by the local veins, shunted back into the systemic circulation, and then go to the site of injury. So regardless of where you inject it, it's going to take the same amount of time for it to get to the spot of injury. By injecting it locally, you might get a very marginal benefit from some of the BPC-157 being able to diffuse to the site of injury, but because it's so rapidly metabolized and taken up, this is going to be very marginal, if anything. So while it's definitely not wrong to inject it locally in most cases, you don't have to. And if you don't want to inject, period, and you just want to take the oral form, you can definitely still get benefit for musculoskeletal injuries, although just maybe not as much, and you'll definitely need to increase the dose to get an equivalent bioavailability. But in general, the oral form is actually preferred over the injectable form for gut issues. Reason being is you're actually going to get direct contact with the gut lining by taking it orally. And the secondary benefit of going the oral route is it might be safer than the injectable route, in a time when the injectable route is only for research use and you can't even get it at a compounding pharmacy. However, a quick point if you do go the oral form is that I would definitely look for an arginate salt form of BPC-157. This is due to the fact that arginate salt forms most likely improve bioavailability due to improving water solubility, buffering the acid in the stomach, and also just aiding in absorption. But what is the theoretical dose for both the injectable and oral forms? Well, again, since there's no solid human data, there is really no correct dose. All we have to go off of is 1, translating the rat doses to human doses, and 2, anecdotal reports of human doses. So first, in order to determine a human equivalent dose from the rat studies, we have to look at what the most commonly studied dose in rats was, which was definitely 10 micrograms per kilogram for the injectable. However, you can't just say then that the human dose is 10 micrograms per kilogram because humans and rats have different body compositions, different metabolic rates, etc. So in the case of converting a rat dose to a human equivalent dose, you have to multiply that rat dose by 0.162. So here that gives us 1.62 micrograms per kilogram per day for humans. However, we're not done yet because the studies in rats are mainly done with intraperitoneal injections, or essentially injecting it straight into the abdominal cavity, which has a higher absorption and higher bioavailability than would sub-Q. And a good estimate for converting intraperitoneal to subcutaneous bioavailability, we basically need to multiply by 1.4, given that intraperitoneal is about 40%, as an educated guess, more bioavailable than subcutaneous. So here that would give us 2.27 micrograms per kilogram per day for subcutaneous injections in humans. So for an 80 kilogram person or 175 pounds, that would give us 181 micrograms per day. And then to convert that to an oral form, given that we said that the oral form is about, we'll say, half the bioavailability of subcutaneous, we would have to multiply that by 2. That would give us an oral dose of 362 micrograms per day. So these would be the theoretical doses if we were just going off of the rat studies. But it's also important to take into account the anecdotal evidence here because it's very hard to actually take into account all the differences between rats and humans. Additionally, every human might require different doses, not only due to different weights, but also due to different metabolizations of BPC-157 or due to different reasons for taking it. For instance, someone might need a higher dose if they have a very new, pretty severe injury versus needing a lower dose if you have a more chronic, low-grade injury. So due to all these variables, anecdotally, there's more ranges of doses used. And for subcutaneous dosing, that's 250 micrograms to 500 micrograms per day usually. And for oral use, that's 500 micrograms to 1,000 micrograms per day usually. And again, since animal studies have demonstrated no toxicity in the short term at much higher doses than what we calculated the human equivalent dose to be, it's likely not going to hurt us too much in the short term to go a little higher than what we calculated that human equivalent dose to be. However, we still have to balance this with trying to mitigate our long-term risk, aka that potential risk for cancer. So we don't want to go too high for no reason. And because of this, the overarching theoretical advice is to stay as low as possible while still getting the positive effect. So theoretically, based on all this, what could be a good idea is to start with the low end of the anecdotal reports, 250 micrograms per day for subcutaneous or 500 micrograms per day for oral use, because this is close to our human equivalent dose from the rat studies, but just a little bit higher. Then you could take this dose for a couple of weeks and check in. Notice if you have positive effects, make sure you don't have any side effects. And if you don't have any side effects, but you're getting positive effects, great, keep it going. But if you hadn't noticed any positive effects at that point and you still had no side effects, then theoretically it could be a good idea to move up to 500 micrograms per day subcutaneous or 1,000 micrograms per day oral. For timing, there are really no studies comparing taking it at different times of the day or even comparing taking 1 time a day versus 2 times per day. So most of this is just going to be speculative based on mechanisms. In regards to when you should take it during the day, it actually matters less than you might think. Compared to hormonally related peptides, in which circadian rhythm and hormone pulsing really matters, BPC-157 is not as affected by this. So really what matters most is you just take it consistently the same time every day. However, you might get some marginal benefit theoretically if you were to take it at night due to the fact that the circadian rhythm does slightly upregulate tissue repair at night. For oral use, theoretically you take it on an empty stomach to improve absorption. So if you wanted to take it at night, you would take it 2 hours after you last ate or right before bed. And then in regards to splitting up the dose versus just taking one larger dose, the rat studies really just use 1 dose per day. So for that reason, and just for sake of convenience, if you were theoretically using that smaller 250 microgram subcutaneous or 500 microgram oral dose, then it might be a good idea to just take it once per day. However, if you were to go up to 500 micrograms subcutaneous or 1,000 micrograms oral, then it might be beneficial theoretically to split the dose up 2 times. That way you can have more stabilized levels throughout the day, given that it is metabolized very quickly. But what is the theoretical optimal duration of a BPC-157 cycle? Well, in the rodent studies, they were most commonly done for 1 to 2 weeks. However, this can't really be equated to human use because rodents have very different metabolic rates, very different rates of healing than do humans, and there's no human equivalent dose analog for duration. So the correct duration, again, is more speculative based on mechanisms. However, theoretically, I would say that an optimal duration would be about 4 to 8 weeks. And if you're taking it for an injury, then taking it until the injury heals, or 4 to 8 weeks, whichever is faster. If you wanted to continue to take BPC-157 after this initial 4 to 8 weeks, I would highly recommend a 4 to 8 week off period before starting it again. Reason being is I think this helps mitigate the long-term theoretical increased cancer risk. However, I would highly recommend not just continually cycling on and off this indefinitely. Again, this one is only for targeted use until it is proven safe. So I would only be using short-term 4 to 8 week durations when absolutely needed, such as for a really bad injury that you just can't fix. I believe that keeping its use then at this short duration and only when absolutely necessary will help mitigate your risks of that potential cancer, while also still giving you the potential benefits when needed. And it's also important to mention here that if you are doing just this short duration use, theoretically an everyday use is going to be just fine, compared to a 5-day on, 2-day off cycle that's often done with more hormonally related peptides. This is done with the hormonally related peptides due to the fact that taking it every day could cause desensitization or receptor downregulation. However, for BPC-157, this is less of a factor, so taking it every day during the short duration would theoretically be okay. And now let's talk about sourcing your BPC-157. Where do you actually get it from? Well, again, this drug is not FDA approved, so this is more of just an educational exercise. But if you were looking for the injectable form of BPC-157, or any peptide for that matter, you really want to make sure you're getting it from a vendor who third-party tests every single batch and gives you a certificate of analysis of that third-party testing for your specific batch. And you have to make sure that that third-party testing contains multiple things, one of which is identification and purity testing with an HPLC or a mass spec test. This will show you that you have hopefully a greater than 99% pure BPC-157. The best third-party tester for this is Janishik. So theoretically, it would be a good idea to find a vendor that uses them for your third-party identification testing. But just because it's tested to be pure BPC-157 doesn't mean it's safe to inject, because you also need third-party testing results demonstrating that it's been tested for endotoxin or bacterial products that can cause a pretty severe immunologic reaction when injected. The gold standard here is making sure that it's tested with a USP85 endotoxin test. And then you're still not done, because you have to make sure that it's been tested for sterility, or basically making sure there are no microbes living in that BPC-157 or other peptide vial. And to do this, the gold standard is making sure it has a USP71 sterility test. And then the icing on the cake would be if they also test for heavy metals and other contaminants, although this is even less commonly tested. So say you do find someone with all of that third-party testing, you get a certificate of analysis for that batch that you have, but you're still hesitant. Well, what you could do in that case is buy in bulk and send one of the vials yourself off for testing to Janishik, for instance. And that would be a good way to know you're actually getting what you think you're getting. But what if you want the oral form? What do you look for then? Well, testing for this actually needs to be less stringent. You don't really need the endotoxin or the sterility testing, because your gut is set up to handle small amounts of endotoxin and small amounts of microbes. So third-party testing for these things is not really common in oral forms. What you should look for, though, is third-party testing for purity and identification. Again, that Janishik style testing, which looks at how pure is your BPC-157. Having third-party testing for that is super important still for oral forms, so I'd look for something that has batch-specific certificate of analysis demonstrating that type of testing. Drop a comment below with what peptide I should review next for our peptide series, and subscribe for the video on TB500 coming soon. And in the meantime, check out how sauna use could also help your recovery in this video here.